Hey everybody, Howard Gearhauser here with my dad, Dr. Richard Gearhauser. Today we have a really relevant, kind of trending topic, I guess you could say. A weight loss prescription medication called Belviq was just pulled off the market by the FDA because of increased likelihood of getting a number of cancers. So this drug was just pulled. FDA doesn't tend to pull drugs off the market, so this is pretty surprising. So we wanted to fill you guys in on why this drug was pulled, but more importantly, I think it's kind of showing the reality of the side effects of prescription drugs. These are very serious, sometimes so serious that the drug will get yanked off the market. So can you give us a little more background on what's going on here?
Yes. So, well, the diet drugs, they've always kind of been controversial. Mainstream medicine likes to have a drug treatment for all conditions. Typically, though, the drug therapies are something that helps the symptoms, but doesn't really get to the cause. So the problem with the diet drugs, and of course, there are billions and billions of dollars poured into the research to try to get a diet drug approved by the FDA, because then you make billions and billions of more dollars. So as an example, this week, this drug is pulled, the Belviq. So the Belviq worked on our serotonin system, kind of like the antidepressant drugs do. So they mess with the brain chemistry. And what they found with these drugs, so Belviq was approved in 2012, which is quite a long time ago. But part of many times the FDA will approve a drug and say, hey, we'll let you put it on the market, let doctors all around the country prescribe it, because the original trial show, it didn't kill every other person. And there was some statistically significant change in your symptoms. In this case, weight. So with the Belviq, patients on it for a year lost about 5% of their body weight over a year. So how does it work? Well, we've talked about before, we talk about all the biochemistry and biophysics that goes on in the body and how important it is. And one of the things we talked about recently was the pro-opiomelanocortin. So pro-opiomelanocortin is a protein that's cleaved into various different things by sunlight, but there's also a pro-opiomelanocortin receptor in the neurons in the brain. And there's one that's called an anorexigenic receptor, meaning it decreases your appetite. And so that's the mechanism. These mechanisms are theories, it attaches them. That must be how it works. They're never sure how these drugs work. But that was the idea, that because they did knock off 5% of your weight loss over a year, a lot of nuisance type side effects. Probably the biggest one was dizziness. People would have dizziness. And they would, but over the year, they would lose 5% of their body weight. And as I say, it didn't affect mortality in those original trials. But part of the agreement with FDA approving it is to say, well, you need to do a study that looks at things longer term. And that's always a good idea. A lot of times these things never happen. The drug company agrees to do the post-marketing research to make sure, something 3 years down the road doesn't happen, because the study's just a year long. And, something like cancer takes a while to develop. So they do these studies as part of the approval. They need to do a post-market study. So they did the study and they found that pancreatic cancer, colon cancer, and lung cancer were increased in the group getting the drug versus a group getting placebo. And it was enough of a difference that the FDA pulled it off the market. So it's off the market. Now you might say, well, okay. And, I don't know what to tell you other than I would stop taking the drug. I would go to your doctor though, because you may want to wean off this drug. We've talked about how the antidepressants are the drugs that affect the receptors in the brain, the neurotransmitters in the brain, that an abrupt stop can lead to a withdrawal syndrome. And sometimes it can be severe with these classes of drugs. So that's something that you may want to taper. But you'll have to get off of it, because unless you go, buy it in another country, maybe that's possible. I don't know. But there's basically 6 drugs that are FDA approved for obesity. So a lot of them are combination drugs. They all have bad side effects. If you read the list, and we can talk about some, but there's Contrave that was approved in 2014. It's a combination of the antidepressant drug bupropion and with it an opiate blocking drug naltrexone. And that side effect of that is suicidal thoughts, suicidal behaviors. Not something I want to take right away. You may remember Meridia. That was, we finally have another drug for obesity. Everyone's out there proclaiming, but unfortunately, it caused heart attacks and strokes, and probably ain't worth it. Losing
so real quick, why? I guess I'm just confused. Why would they pull this one specific drug, Belviq or whatever, if all of these drugs seem to have deadly side effects? I mean, if not deadly, catastrophic side effects.
Well, Meridia, they did pull it.
They did pull it. So
yeah, Meridia, because of heart attacks and strokes, and it was for people that were high risk for those. There was an increased heart attacks and strokes, and they pulled it. So
what about these other ones, though, like suicidal thoughts, for example, or not even just in the weight loss drugs, but looking at prescription drugs as a whole? I think our viewers,
there's probably 50 drugs out there that increase suicidal thoughts. What, they're going to pull the whole market of drugs? I mean, the FDA is paid by the pharmaceutical companies, pay a fee for the FDA to do all of its functions. So really, the pharmaceutical companies control the FDA, because that's where they get all of their income to function. So they have to play the game with the drug companies. They can't just ban every drug because it makes you think you want to kill yourself.
Right. But so do you think it's more like they pull some just to almost prove that they're doing their job to some degree, like rather than like we blanket pass every single drug and every single drug stays on the market? Like, I guess why this specifically? Is it just kind of like we're making a statement that we do look at these drugs and we do look at the side effects, and we are actually holding the drug companies accountable? Because you're right, it seems like the FDA and the drug companies are one and the same to a large degree.
My feeling is, I mean, I don't think this is on the surface of the brain. Like, I don't think these FDA panels are evil people. I think, they think they're doing their job, but there's this hidden agenda back there. And so Belviq, approved 8 years ago, patent lasts 7 years. It's made its money. The drug company's not going to pay us any more for it. Cut it off. So that's why they go, hey, we'll do this post-marketing study. They'll take about 5 or 6 years. As soon as the patent's wearing off and you can't charge $10 a pill anymore, you got to go back to 25 cents a pill. No big profit, no billions of dollars. Drug company probably agrees. Well, what the hell do we care? We're losing our patent. They're going to start making it in India now. It's going to be 5 cents a pill. I mean, unfortunately, the generic drugs aren't always cheap, as we see in our society now. Some generic drugs cost as much as the patent drugs now, because there's really, really smart people in the system getting around. Oh, well, all we have to do is make a deal, with a legislator or a drug company or FDA or whoever. Let's make a deal and we can crank up the price. And so this is happening. You'll see that you can go to the pharmacy to get one drug, and it could be, and this has happened to me, get a drug an old drug, it's $50. Go, old drug, because sometimes you get an old drug and it's $3. And so you're kind of happy. Oh, I'm glad that was an old drug. But sometimes you get an old drug prescribed and it costs $50 and you can't figure it out. Or sometimes it costs $400. Okay. There's an old drug used to treat gout, colchicine. So colchicine skyrocketed in price, even though it's an ancient drug. It was dirt cheap, but suddenly it's costing $300-400 for a prescription. Why? Well, the FDA, in my opinion, in order to generate some more income, they go, hey, drug companies, if you do the drug's so old that it has very few studies. It was just, in the old days, you just use something. If it worked, you kept using it. And so drugs like colchicine would be out there with very little research. So the FDA says, hey, we make a lot of money when drug companies do research. Let's give the incentive to do a study on an old drug like colchicine. And if you do that, in turn, we will let you have a monopoly on it for 2 years. And you can jack the price up to whatever you want. The generics will not be allowed. That's exactly what happened with colchicine. That's exactly what's kind of cycling through a lot of the old drugs. And, another way they do it is they cut off the production of old drugs, like insulin. Lately, insulin, an old drug, not even really a drug, it's, insulin's a protein that's naturally in our body, but insulin just became too expensive to afford if you didn't have health insurance. And insulin, you die in a few days without it. If you have to have it, if you have no insulin in your body, you have to inject it. And now suddenly the price skyrockets. Now that, enough people complain about that Congress says, oh, we're going to fix that. We're going to make it illegal to jack up the price of insulin or whatever. But what I'd like to talk about today is the obesity drugs are a bad idea. All 6 of the FDA approved obesity drugs, they all have bad side effects. They're not addressing why you get obese. Why do you get obese? Because of our modern world. If you look back at videos around the turn between the 1800s and 1900s, look at like a city street in New York or wherever, everyone is thin. Everyone is thin. It's like, try to find a fat person. There ain't one. Now, 60% of our population is overweight or obese. Okay, so it's the new normal. It's new normal to be overweight or obese in our country. So what has changed since way back then and now? Well, our environment has changed. We're totally indoors. We all have broken circadian rhythms. And so we talk ad nauseum about fixing your circadian rhythm. Biggest thing you can do for your overweight. The biggest way to do that is see the morning sunrise. Now, we talked about pro-opiomelanocortin, how it cleaves off peptides that will cause your adrenal gland to secrete its hormones. It'll cleave off endorphin, which makes us happy and makes us addicted to the sun. So the sun does all these things. Sun increases your serotonin. So you don't need the dang drug to increase your serotonin. You need to fix your circadian rhythm by reconnecting with how people lived back in the 1800s. They got up with the sun. When the chickens started howling, or I guess chickens don't howl, when they started cock-a-doodle-dooing, you got up because they were too loud. You ever been on a farm and that rooster, you want to strangle it because sometimes they start at 4 a.m. So getting back to that circadian rhythm, the other end of it is blocking the artificial light that resets your brain as if it's still noontime. If you turn on the LED light at 9 p.m., it's telling your whole system it's noon. Shuts off melatonin, and it gets you in a daytime ready ready to fight your day mood, but it's time to go to sleep. What do we do during sleep? We repair. What happens to people that sunbathe or have an outdoor occupation? They're much thinner than people who avoid the sun.
So most people who are taking these prescription drugs, I'm sure, have bought into, at least at some point, into the paradigm that diet and exercise are kind of the main things that control weight, and circadian rhythm isn't really talked about as much. It's starting to be talked about more nowadays. But diet and exercise, looking at those individually, why don't those really contribute as much to weight loss as we would think?
Well, diet plays a role because diet is one of the things that controls our circadian rhythm. So diet is important, but it's important in a different way than counting your calories. So we know that counting calories will help you lose weight, but you lose mostly muscle and water, and it doesn't stay off. So it's a total abject failure to count calories. So counting calories is not a way to do it. And that's, of course, the main paradigm. Or it could be, a ketogenic diet, or it could be a high carb, low fat diet. All these will cause a weight loss, but a big portion of that weight loss is muscle and fat. Now, intermittent fasting, which is what we naturally did in nature because we didn't have refrigerators and restaurants and McDonald's on every corner. So we naturally intermittent fasted. And so when you intermittent fast, that's another way to lose fat instead of muscle. So that's what we have our health coaching clients do. We have them, number one, fix our circadian rhythm, because not only does that help you lose weight, but that prevents you from getting cancer or helps your body fight off cancer or any of what are called the modern complex diseases. And that's, the things that are exploding today: obesity, diabetes, neurodegeneration, cancer, heart disease, autoimmune disease, mental disorders. These things are exploding right now. The drugs, like the obesity drugs, almost every other condition, whether it's diabetes, the drugs are a panacea especially like these drugs for obesity and the drugs for diabetes. They're a panacea for about 5 years until those post-marketing studies are available. And then we go, holy cow, that drug isn't so good. But luckily for the drug company, they've already made their billions of dollars, and they've moved on to developing the next drug that they'll have a monopoly on for the next 7 years. So that for the system, this is the perfect scenario. FDA outlaws it. I ain't going to make a dime off it anyway. Or, it's going to go from, I don't have no idea how much they're making off this drug, but it's going to go from, let's say, $2 billion a year down to $500,000 a year, which isn't even enough to pay the rent on all your built labs and buildings.
So the diet, like we just mentioned, diet is important, but in a different way, not from a calorie counting standpoint, but from a resetting your circadian rhythm. And then incorporating the intermittent fasting, just eating in a way that's more the way our ancestors might have eaten, as well as seasonality, which we didn't touch on so much just now, but we have a whole video talking about intermittent fasting as well as eating seasonally based off where you live. So you should go check that one out. I'll actually put a link above right here to where you can check that one out. Let's talk about exercise for just a second as it pertains to weight loss. So that's another big recommendation in the mainstream, is exercise more to lose weight. And exercise can be healthy when you're functioning properly, but what we've noticed with our health coaching clients is that if you're exercising when you're highly damaged, it can be counterproductive and actually cause you to age much faster. Can you elaborate a little bit more on what's going on there?
Yeah, well, this is something that I experienced, personally, that the over-exercise syndrome, of where you get in your mind that exercise is always good. And this is like the drug addict, that gets high on heroin. And so the heroin makes them feel good. And so they can't get off it. So the exercise is the same way. It stimulates that release of beta endorphin. It stimulates the adrenal gland. because think of, stimulating your adrenal gland, stimulating the stress hormones, cortisol and adrenaline. You stimulate those to run. So if you're running, you have to stimulate this fight or flight system. Yeah, and that's not bad to do intermittently if you're healthy. But when you have a disease, when you are in the stress response, you're not going to deal with your disease, because the body senses when you're in the stress response that a tiger is going to bite me on my leg within the next 2 minutes. I have to be highly vigilant, watch that tiger's teeth as they come near my leg, and I have to grab a big club so I can smash that tiger. And I don't care if my melatonin is low, or I don't care, if my liver's starting to develop fatty liver. I have bigger things to attend to. The tiger's teeth. Okay, so you're never going to heal from anything if you get addicted to exercise. And that was me. You can hear about my story in another place where I had a total breakdown of believing that exercise is always good. But no, I was addicted to it. I was addicted to the adrenaline rush of it and the endorphin high of it. And it got to the point where it was the only thing that woke me up. In other words, I felt like crap unless I exercised, but that was the addiction. And so this might ring a bell with you that, hey, turn a light on your head. For those of you out there in this scenario, that's what happened to me. A doctor that I respect that has really weird ideas. I talked to him on the phone and he said, the same thing to me about 10 years ago. And I took it to heart. I knew he was right. I just intuitively go, wow, what a revelation. Changed my life. Just somebody telling me 3 minutes of that much exercise shows that you are addicted to it and it's going to kill you.
And the other thing with exercise, I think when we get into this 5 small meals per day recommendation, or eating more to burn fat type of deal, we feel like compelled to exercise because, wow, I just stuffed my face. Now I need to go to the gym and burn it off. When you buy into an intermittent fasting protocol and you're consuming way less, you actually have less desire to go exercise. So, you're more in a conservative position there. Like, I want to conserve my energy. I'm not stuffing my face 5 times a day. I get one meal and a snack type of thing. You're not going to go burn energy unnecessarily, and you can really harness that energy for cognitive ability, for your body to repair. And if you kind of think of your body as a car, you're putting way fewer miles on the car when you're living more in a let's conserve energy standpoint, rather than let's go drive the car and floor the accelerator every single day. Like, you're going to put way more miles on that car way faster than someone who's taking the car for a spin once a week, for example. So which car do you want to be is kind of a way to think about this. And we know a lot of people who are just so highly addicted to exercise, and they look 10, 20 years older than their age. And you combine that with your circadian rhythm being thrown off, where you're not getting that recovery in your sleep, it's really a downward spiral from there. And you think you're doing something healthy. That's kind of why exercise specifically can really bite you. You think you're doing something great for your body, but it's actually causing you to age at an accelerated rate. So what can people do other than circadian rhythm if they're trying to lose weight specifically? What other things can they try?
Well, as they say, the sun exposure helps you with every degenerative disease, including obesity and diabetes. So that would be the biggest one, is to, like I'm doing now, I have an outdoor office because, I live kind of an indoor lifestyle that 99% of Americans do. There are construction workers and things like that are outdoors all the time. Most of them are covered up, especially here in Arizona, covered up completely. So I think even those people have a problem of lack of sun, because Everyone believes that the sun, not everyone, I'm trying to change that, but many people believe the sun is bad. And I think our mainstream medical paradigm or dogma has taught us all that. And it's, it's taken a long time, but I think we bought into the sunglasses, sunscreen cover up. And I believe it's caused multitudes of deaths and misery, those recommendations. And the extent at which people have bought into it. And it's not new. We started covering up like back in the 1800s. We started wearing the long pants and the women wore the long dresses and the bonnets. So, and that's about when we started getting Alzheimer's. Wasn't present before that. So it's been a slow process, but now it's just exploding when we add on top of it this wireless waves. So the sun communicates with us with wireless waves, and we are increasing our wireless waves in our environment exponentially, and we know they cause issues in our cells. So that, thousands of studies now showing there are biologic effects of these waves. So that's the other thing that we all have. I have right now, you have right now, unless you live like in Death Valley in a cave, there is a cell tower near you. And there is a satellite beaming a wave to you. And there's a radio antenna, an AM over here and an FM over there. If you live in a big city, you might have a dozen FM stations. And if you could see this, and you can with certain meters, if you could see all these waves, and then you go out into nature or go into that cave and see how many waves are there, just the Schumann's resonance of the Earth's electromagnetic wave. And then you see the just chaos of thousands and thousands of waves in the big city. You go, hey, I want to become a pagan again. What is a pagan? And there's, pagans obviously has a religious connotation. But before that, pagans were people that lived out in the country. And so it's gotten to the point where I have to recommend to people that are really, really bad, come to me for health coaching, or a patient and they're really, really hard off. I say, you need to, and we figure out, it is from this exposure. There's ways to test that we'll talk about on another video. I have to tell them, you got to get away from 12 FM radio stations, military radar, a cell tower a quarter mile away, and 5G beamed into all the big cities now. Just, it's layered on top of everything else that's already really bad. So I'm not one that believes that 5G is the end of the world. It's the whole ball of wax is the end of the world. Once we kill off, say half the insects and half the birds, hopefully we'll wise up that we got to go at least partially back to a wired system, or at least put a moratorium on just keep, at some point, we're going to explode like a balloon.
Yeah, so taking
although I'm optimistic.
You got to take those nature
popping
breaks.
Doesn't mean you're dead. It means you go to another dimension.
Yeah, it's definitely start incorporating those nature breaks, especially if you live in a big city. I live in San Diego, so it's important that I'm, getting to the beach, going on hikes, getting out of the city, because there's a lot of electromagnetic fields here and electricity and power coming through. So you need to give your body a break from that, absolutely. And on a daily basis, counterbalance it with sun exposure, and just getting outside in general, get some of those natural waves going. So we also talked about the intermittent fasting. That's another good strategy where you can maintain muscle too, which I think is really important. You don't want to lose weight and compromise all of your muscle. That doesn't really make sense. And then another one's cold therapy. We're not going to go into that right now. We have a whole separate video on cold therapy, so you should check that one out. But that can help stimulate fat burning as well. And then one thing I would add as just a really important daily practice is your meditation. By meditating every day, a number of things happen, but I would say one of the most important ones is you become more mindful of the choices you're making. Normally, weight gain and fat accumulation is really that. It's an accumulation of choices that you make on a daily basis. You don't pack on a bunch of weight in one day, typically. So by meditating and becoming more aligned with what you need energetically is going to help you make better choices that fit that. And that might not be the same food every day, for example, or the same fasting period every day. You might find that, hey, I need some food right now, and here's what feels like will nourish my body. Meditating daily is going to kind of keep you calibrated as to what you need and help you make the right choices moving forward. Then it's sustainable, and our thing isn't about having no body fat. That's another extreme to where your self-image is so important that you're stressing yourself out. That's not for everyone, but I've noticed that with people who get really hell-bent on the exercise and making their diet really unbelievably strict, they're on the other side of the scale to where they're constantly stressed out about that. So you got to find that balance. You got to find that happiness within. Even if you're super overweight, you can still find a way to be happy now. And by being happy now, you'll start treating your body with more respect. Is there anything you wanted to add to that, Dad?
No, I think that's a good point. If you're in the present moment and not worrying about tomorrow, not worrying about yesterday, not thinking about the worst case scenario that puts you into the stress response, meditation is a great way to get you out of the stress response so your body can start to heal. And one of the things obesity is a reaction to us over the long term not healing on a daily basis. We're not fixing things, and so our body really goes. It's a huge crisis and becomes a hoarder, becomes a prepper, prepping for that worst case scenario that you've been thinking about every day. So if you're in the present moment, you're not thinking about the worst case scenario. So you can bring yourself out of that.
Exactly. The body oftentimes stores fat as a survival mechanism, kind of like a bear before it goes into hibernation. It's like, hey, we might not be getting food for a week. Like, let's store fat. That's a great thing if you're not getting food for a week. But when the stress is mind created and it's not really created from a real circumstance, food shortage, or you're about to be attacked, or, whatever, the survival instincts, then you're packing on weight unnecessarily. It's not a lack of food. So then you start to eat food and this problem persists. If you can learn to turn your stress response off or transmute it into positive emotions, that's how you can kind of really live with minimal or highly reduced stress. And then your body doesn't feel the need to pack on weight as an energy reserve. So we'll end it on that note. A lot more free content on the Quantum Possibility YouTube channel, as well as the Quantum Possibility Facebook fan page. We also started an Instagram where, we have shorter clips and whatnot, and also links to these various videos. So go follow us there. That way you can be in the loop anytime we post new content. We are posting a video every single day. For those of you that have been following, you've seen that. So make sure to stay up to date with that. Also, I'd like to throw this in there. For those of you that would like to work with me and my dad and our team of experts to help kind of figure out what you need to be doing to optimize your health, optimize your mind and body, and even your spirit, we do have some openings available in our health coaching program. So I'll throw a link in the description if you want to go check out the details on that. It's not for everyone, but if that sounds like something you're interested in, go check it out. If not, make sure you're implementing the free information, and we'll see you on the next video. Thanks, Dad.
Thanks.